Alright, so today we're going to talk about the ankle joint. So what type of joint is the ankle? It is a hinge joint made up of 3 bones mainly. We got the talus, which is the lower part of the top part of your foot, and we got the tibia on the inside of your foot and the fibula on the outside of your foot. So where they connect basically makes it so it goes up and down, mainly a tiny bit on the side, which we're going to talk about now. We're going to talk about the 4 way the ankle moves. It moves as a dorsiflexion, so you're pulling your toes up towards your face. We got plantar flexion, you're pulling your toes down towards your face. We got pronation, which is going to be where the ankle rolls in and the foot rolls out, right? So the ankle rolls down and you have no arch anymore. And then we got supination, where the ankle goes out and you have a massive arch on here, right? So those are the 4 ways that the foot moves. So we're going to go over some limitations of each one. So overpronating, which would mean that your knees are going to go inside. So when you're overpronating and you're squatting, for example, it causes a big chain reaction where you're putting a lot of pressure into the inside of your knees. We also see some people do poor dorsiflexion, which can mean that the chest will go down and it becomes more of a hinge pattern because they're not letting that knee drive forward. They have really low mobility here, not essentially letting that knee fall forward. Another thing that we see is bad plantar flexion, when we sit on our butt and we have the inability of not allowing our butt to go down, so we have to pick up our heels just because we don't have that flexibility on the ankle. And one last one that we see a lot is drop foot, and that's basically under dorsiflexion. So essentially, drop foot would be when you drag your foot just because you don't have the muscles to dorsiflex your foot.
Can also be a result of nerve damage or lack of nerve activation.
Yeah, that's usually a result of nerve damage, which doesn't allow any buildup of the tibialis muscle. That's one we see all the time, and it's hard to squat because when you have that, you almost have either too much range of motion but no control over that range of motion, right?
You would also have a really hard time walking on your heels with drop foot.
Yeah, exactly. And then you want to say why ankle mobility is important?
Ankle mobility is important for lots of reasons. If I have poor ankle mobility in all those different ways, it will affect the rest of my chain, right? The way I squat, lunge, jump, walk, my gait, everything. So it's important in the gym environment.
And we're also an FYI, we're barefoot just so we can show you and show you the way the ankle is moving a lot in all different ways of motion, and the way we're going to talk about the tripod of the foot. So we're going to our main concern a lot of times becomes dorsiflexion and lack of dorsiflexion. So we're going to just spend some time on dorsiflexion. Remember, dorsiflexion is the ability to pull the foot up, right?
Yep.
So we see a lot of flexibility issues with calves, right? Calves being too tight, soleus, which is the muscle behind the calf, being too tight. That also affects your Achilles tendon. So when you hear people's Achilles tendons being too tight, they probably have a really hard time squatting. Being really tight here and behind and through the ankle and all the way up to the calf doesn't allow you to flex forward. That creates some problems there. We see it all the time. A lot of times where we talk about how we'll fix those issues in a little bit. We also see some joint restriction issues, and that usually happens from a previous injury, either in the ankle or around the body. That a lot of times, let's say you roll your ankles a lot when you were younger, playing basketball or something, that usually means you have a lot of scar tissue, which doesn't restrict a lot of the movement that you're moving around.
High heels.
Wearing high heels is another one. You want to go over that one?
Yeah, I mean, wearing high heels, probably you've heard of this one. If I'm constantly in a plantar flex position, my ankle gets very used to it. My calf gets tight, right? And it doesn't want to go like this anymore. So I'm very good at being on my toes, but I'm not very good at being on my heels, right? So the repetitive idea of walking in high heels every day can prevent you from getting pretty good dorsiflexion in your ankle. And then the last one is injuries up the chain, right? So just like the ankle affects the rest of the chain affects the ankles as well. So if you have injuries in your low back, hips, or knees, and you're compensating movement because of that, maybe because you're in pain, you could be limiting range of motion on your gait or the way you're standing up and down or using your ankles, which would produce tightness, right? If you don't move the body, it gets tight.
Yeah, and then so let's talk about a little bit of how we in our facility test for dorsiflexion. So one of the main things that we do for test for dorsiflexion is the squat test, right? So we'll have somebody squatting, and we're gonna look at if their knees are going past their toes, mainly for dorsiflexion, right? So that would be a good squat pattern. Her knees can at least get to her toes, past it is a plus. If they can't get behind it, we're going to build that up. A lot of times when their knees cannot get past their toes, I already know that that means that they're going to put a lot of load into their hip. They probably have lower back pain for the most part, just because they're used to putting a lot of pressure into their back instead of their quads and knees. Anything else?
You might see people pulling their toes off the floor, which is a very common thing with lack of dorsiflexion, is they're kind of pulling up on their toes. Hence why having someone demonstrate things barefoot is really helpful, because if they're in a big shoe, you might not even see that they're pulling their toes off the ground.
Yes, so a lot of times we'll have people take off their shoes in the gym when they're assessment or their sessions, just so we can see how their foot reacts. And when they're taking their weight off their foot, essentially being in a bad dorsiflex position, they're also putting a lot of weight in their heels, right? Another movement that we do to test would be just to be a calf raise. And that's, let's say, if Heather's going up and down, apart from being lack of strength, up and down, and she can get all the way up and down, that's a 180-degree angle, but let's say she starts leaning her body weight forward, that just might mean that, with her hips forward too, that might just mean that she has poor flexibility in her ankle to get all the way up, right, apart from strength.
I'm compensating. I'm trying to execute the movement. Internally, that's what people are always trying to do. They're trying to execute the movement for you, whether they know it or not, and the body's kind of taking its best route to get there.
Yeah, so, and then one more that we see a lot, or that we work on a lot, is, without even having them squat first, would be the wall ankle drill. So basically we start people with their toes on the wall. Let's act like this is the wall, and their heels on the ground. So we'll have them go forward, trying to touch their knee to the wall, and if they can do that, we're gonna go slightly back, an inch or two, go forward again, until we can get at least 4 inches. If we can get 4 inches, which is usually the palm of your hand, for example, is usually 4 inches. So if I can stick a fist in there, that's a good sign, and they can keep their heel going down and their knee going forward. That's usually a good sign of good ankle flexibility, and I'll usually do this before a squat to see how their squat is. If they cannot do a 4-inch knee past toe, that usually means they're gonna go into a hinge squat pattern, right? So it usually means that they're gonna go into somewhere like this, where they're dropping their chest. So these tests will tell us a lot before we even have to deal with the client on what they're doing.
One other reason why you would start right against the box versus all the way out at that 4 inches is in case you develop pain. Because some people, if they're really tight in their ankle, it's going to produce knee pain, and you obviously wouldn't want to do that to someone. So you're going very slowly on the progressions of it, because back in the day, the whole idea of putting your knees over your toe wasn't correct, right? So a lot of people have been working out like that for years, creating a tight ankle and a tight knee.
And then let's talk about a little bit about how does it affect your movement pattern with poor dorsiflexion. So depending on the level of inflexibility in that ankle, it may cause a permanent movement. You can't control your movement. It could cause it being a longer thing to take care of. A lot of people don't understand how much immobility means in terms of range of motion. So if you have a squat that looks like this, do you know how much we're gonna have to work to get lower? A lot, right? Anything else?
They literally can't get their heels on a squat without assistance, right? Like that's a really bad movement pattern, right? So if I can't even get anyone to execute a squat because their dorsiflexion is so bad, that's a big deal. Yeah,
and we try to fix this by doing doing 2 things. We'll load them up to whatever range of motion they can, but the other thing, we'll do a little cheat where if you have, go ahead and step on. You have a slant board, or you have some plates like I have over here. We'll have them put their heel on the slant board and their toes on the ground, where they can squat with the heel elevation, essentially wearing like heels. They're able to get their knee past their toe, and we'll start dropping that elevation slowly as they get better and better until their heel starts getting onto the ground. That's a long-term view of fixing this specifically dorsiflexion movement
And the reason
pattern.
why this is assisting me is because it's helping me, it's helping my compensation, right? My calf is tight, so my calf prefers to be like this, or my ankle, the actual joint is tight. So my body itself already likes that elevation. So when I'm feeding into the issue almost, but in a helpful manner, because now what it's gonna do is it's gonna allow me to get deeper, activating all that back tissue in my body. So long term, it is actually helping my mobility and the rest of my body, even though it kind of seems like a cheat.
Yeah, and then your knee and your hips are tracking the right direction. We just have to worry about your ankles, but we're doing ankle mobility work on the side at the same time as we're working on loading your range of motion. The other thing that we see a lot is the poor ankle mobility causes the tibia to be dragged into a more vertical position. We just talked about this, is no way of saying it. You want to demonstrate it? So essentially, it just means you become a heel-loaded squatter because your shins don't move forward. Another way of saying it is just you're staying vertically with your shins, right?
And you'll see that could be a big issue with jumping, right?
Exactly.
We love to teach power. I mean, power is really important for people, and especially older people. And if you can't dorsiflex your ankle, you can't get that horizontal movement in your shin, you're gonna be a pretty poor jumper.
Yeah, not only that, but you gotta think about your landing mechanics. So if I'm trying to jump and I'm leaning forward, that's good dorsiflexion movement. However, if I'm trying to jump and I'm leaning back, I already don't have any strength to push up. And I'm landing, I don't want to land in my heels, it's gonna strike my knees and my back, essentially putting more pressure into the upper part of the next joints, right? Yeah, so it is an inability to generate maximal force. It hinders your ability to generate maximal force. And then the other one is what we talked about, the drop foot. It doesn't allow you to pick up your toe. So then what we find is that the person that has a drop foot has a really hard time squatting because they can't pull their toes forward or essentially shift their knees forward, not vertically, making it another hinge pattern, right? Anything else you want to mention on that?
No, I think we should go into pronation, supination.
Okay, so then the other one that we have a lot of in facility, the 4 movements, is pronation and supination issues, right? Specifically pronation issues. So one big thing that we see is people always rolling their ankles in, essentially pronating their ankles, right?
Losing that arch support.
Losing the arch support. So go ahead and demonstrate a squat for me in a pronation. So when we have people pronate, it just basically means I can watch it just by squatting. I can watch it on the weight. Go ahead and walk. Face away from the camera and walk slightly. You can see somebody has pronation issues. Their Achilles tend to come in and they drop their foot every time, right? So they drop the arch into the floor. So I can see it by walking. I can see it by squatting. Which is, if you can see it already just without asking to do anything, it's a big problem. So what we try to do when we try to train, and that's where the reason we're barefoot, is we try to train a tripod position. You want to talk about it?
Yeah, so the tripod of your foot is a triangle, right? So you've got your baby toe, your big toe, and your calcaneus, your heel, right? So triangle. A triangle is a very stable structure, right? So a very simple, almost like a magic trick to fix someone with pronation is to teach them a tripod, right? So I pronate, so what I'm gonna do is I'm gonna spread my toes, I'm gonna grip the ground, pulling my arch off the ground, almost like my hands, right? I'm gripping the floor with my toes, but thinking about it like my hands, right? Pulling down and pushing in. My baby toe, my big toe, and my calcaneus are my major drivers. So now that I have that good arch off the ground, when I squat, if I'm being conscious of that tension, it should keep my arch off the ground, which is what pronation is, right? Is that arch failure, strengthening my foot and getting my knees to track better, activating my hips the way I want them to be activated.
Yeah, so that's also a test that we use for measuring pronation, is seeing if their knees cave in, like we talked about already. And a test that we use for supination is seeing if basically they're taking weight away from their toe. So what does supination look like? Supination is basically having too high of an arch, right? So if you're having too high of an arch, you're taking all the pressure off that big toe, putting all the pressure in that baby toe and calcaneus, but it's also affecting your squat pattern and making it really weird looking. Yeah. We don't see that as much. We don't seem to have to fix that as much, but we still test for it and see if we need to. Well, the things that we would do to fix that is probably put some wedges in. So for example, if she had a supinated foot and she's not putting any pressure on her big toe, what I would do is I would put a wedge into her big toe so she can be conscious of putting weight into her foot. And then the same thing on it. Go ahead and try to squat like that. So that would try to fix our supinated foot. And if we needed to fix our pronated foot, if she's going inside, I'm putting weight into her baby toe. I want to make sure as she's squatting, she's not picking up her baby toe. You want to show that? So she's putting pressure. I'm not able to lift it. That means there's a lot of pressure on her foot. I can feel there's some arch going on there. So that's just a few tricks and few ways where we quickly fix pronation supination. We will go over a lot more in in-person session on that.
And you can look at that from multiple angles, right? Like it doesn't have to be the front of the foot. It can also be the posterior side of the foot, the calcaneus, right? Because supination, the person's going to load the inside of their heel more. Pronation, the person's going to load the inside of their foot more, and supination, they're going to load the outside of their heel. So you can always use a wedge in that sense as well. Just micro little movements make a big difference.
Yeah, and then another thing that I forgot to mention that we do a lot too is toe walking. depending if you're lacking or strength on the tibias or you just need more work bringing the tibia muscle together. Or I'm sorry, that was heel walking. Or we can also do toe walking, right? So we can heel walk on our heels, forward, backwards, side to side. Same thing with our toes, forward, backwards, side to side. And that tends to help us engage some of the muscles in the foot, the calf, and all the way up the leg chain.
It's a great warm-up too, just for the older population who doesn't use their ankle and their knees a lot, just getting them balance activity, coordination, and strengthening the lower leg. Another thing we use a lot is baby hops.
Yeah, so for baby hops, so for example, if I'm doing a baby hop, I want to have my knees past my toes, even though I'm bringing my heel up, but it's making my ankle a little bit more stable, right? So some people have instability in the ankle, some people have too much stability in the ankle. Baby hops make my ankle a lot more stable. So I want to keep that ankle joint nice and stiff to be able to perform this motion, right? And then another thing that we want to talk about before we finish is stretches and dynamic and static stretches that we use to work on ankle mobility, right?
Yeah, because just because someone has a tight ankle doesn't mean we're not loading them in a squat pattern or a deadlift pattern. We're using those assisted things that we showed you before, whether it be the wedge or the slant board, things like that, but we're always still loading them as well. And then on the side, we're mobilizing and stretching.
Or they can do it at home if they already have the equipment, right? So one of the big things that we like to do for the calf, for example, would be to either put a lacrosse ball or a foam roller underneath and just roll that ball side to side, forward and backwards, anywhere from the bottom of the Achilles tendon to the top of the calf, just to make sure we're making that loose if they have really poor dorsiflexion.
Another one we like to do in the beginning, which we would consider more dynamic, is an ankle rock, right? So I can use this box, especially if someone's extra tight. Some people also have a hard time getting down onto one knee, so an elevated surface as a box or a bench is a great way to do this. So I'd have them step up on the backs and I'd say, I want you to maintain connection with your heel the whole time, but I want you to drive that knee back and forth over those toes, right? So before I have them squat, maybe after I've done their mobility stuff in the beginning, I'll have them just really focus on isolating the ankle and mobilizing.
You can do that on a box, or you can do that in a half kneel position on the floor, pushing your knee forward with your hands helping you out too. The other thing that you can do is doing doing the opposite of the heel elevated, putting toes elevated and trying to go up on a calf raise and down slowly in an eccentric way to try to stretch out the muscles in the calf. The other one you can do is try to...
And that would be good for dorsiflexion.
That would be really good for dorsiflexion. Another stretch that you could do is lift your toes up on a higher surface and slowly getting bigger and bigger. You can push your knees forward, keeping your toes on the ground, and that's putting more pressure into your ankle at the forward, on the front part of the ankle, yeah. Another thing we talked about is, shoot, I just forgot it. Damn it. I think that might have been it.
All right, well, if we think of anything else, I'm sure we'll cover it in the in-person. But this is just an example that, you're gonna have limitations all over the body, especially with the age range of people we work with, but we always try to make sure we continue progressing forward with major movements and then feeding in accessory stuff along the way like this. But yeah, the ankles are very important and we focus on them a lot.